What happens when there's inflammation inside of your eye? It's called uveitis, and Dr. Emilies Seitz will be joining us on this episode of OCuTALK to explain more about what it is, warning symptoms to look out for, and different treatment options available. Dr. Seitz?
I want to talk to you.
Not now, later.
No, now.
Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us, all the way from Charlotte, North Carolina, Dr. Emilie Seitz. Dr. Seitz, thank you so much for joining us today.
Thanks for having me. I'm pumped to talk about this topic we selected. It's something I have a good amount of experience with coming out of residency, so I'm happy we can dive into it.
Well, perfect. We're excited to have you here. And again, thank you for taking the time out of your day with us. But Dr. Seitz, before we get started, I was hoping that maybe you can talk a little bit about your background and your specialty to our viewers.
So my name's Dr. Emilie Seitz. I'm originally from Cleveland, Ohio. I did my undergrad at Ohio State and then went to the Pennsylvania College of Optometry for optometry school. During externships, I kind of went all over the Midwest just to get a wide range of experience before deciding to pursue a residency in ocular disease at the Salisbury, North Carolina VA. After that, I decided to stick around the area and get North Carolina board certified and licensed. And now I kind of practice in a little bit of a private practice that's high specialty dry eye. I also practice in a rural private practice where we see all kinds of disease that walks in. And corporate too. So it's a lot of different things that I love to dabble into, and I have a wide range of ability to care for a lot of different patients with a lot of different needs.
Well, excellent. Again, thank you for that, Dr. Seitz. And again, thank you so much for joining us today. So Dr. Seitz, for our discussion today, we were hoping that maybe you can talk a little bit about ocular inflammation or uveitis. What exactly is uveitis?
So uveitis is essentially defined is intraocular inflammation. So inflammation that's occurring inside the eye. The main structures that are affected are structures that we call the uvea. That's why it's called uveitis. Uvea, these structures, itis meaning inflammation. So the structures that are mainly affected are the iris, the ciliary body, and then in the posterior part of the eye, the choroid. Now, the other way that we can talk about uveitis, we can kind of classify it in a lot of different ways. And one of the main ways we can classify it is based on what we're just talking about. Where is it located? So you can have an anterior uveitis, and that's inflammation that's occurring from leakages in the blood vessels at the front of the eye, specifically, what we call the endothelial cells, or the junctions that are supposed to hold everything inside a blood vessel. Those are what's leaking when it comes to anterior uveitis. There's also intermediate uveitis. So when intermediate uveitis occurs, we're talking about things that are happening posterior to the lens of the eye and the vitreous cavity. So in intermediate uveitis, we end up seeing cells in that vitreous or jelly-like material that's at the back half of the eye. You can have posterior uveitis, and that affects mainly the retina and the choroid of the back half of the eye. And then you can also have panuveitis, which essentially we refer to when we said, hey, it's difficult to tell where this is coming from, but we're seeing it at the front half of the eye, and we're also seeing it at the back half of the eye. So lots of different ways that we can talk about uveitis, but the main thing to understand is that it is inflammation that's occurring inside the eye.
Well, perfect. Thank you so much for that explanation, Dr. Seitz. And Doctor, are there different types of uveitis? Can you go a little bit further into that?
Yeah, so like I was saying, there's so many different ways that we can classify it. We kind of look at it as eye doctors and we say, okay, is this a granulomatous uveitis or a non-granulomatous uveitis? And perhaps an eye doctor maybe has never broken it down into that much detail or explained it, but it just helps us a little bit understand, okay, what's the etiology of this inflammation? Where is it coming from? Typically in granulomatous uveitis, what's happening is it's your own body having this extreme response. It's an autoimmune response or an overreaction to either something that's an autoimmune disease or something that might have like an infectious etiology. When it comes to non-granulomatous uveitis, It's typically due to a non-infectious origin. But still, it's the body responding. It's responding to either something like maybe trauma that's happened from surgery. It can also be associated with some other kind of autoimmune conditions. But again, it's usually not an infectious etiology. The other way that we kind of break it down too, when we're looking at those differences between granulomatous and non-granulomatous, it's kind of the cells that are involved in this immune response. So there are different kinds of cells that can come into play. And namely, the cells that we're talking about are things like white blood cells, things like macrophages, things like eosinophils or basophils. And those are all very technical inflammatory cells. But the degree in which they happen and the different cells that are involved also play a role in how we kind of classify it and talk about the different kinds of uveitis.
Well, excellent. Thank you for that information, Dr. Seitz. And are there risk factors involved in this, or what are the risk factors involved, should I say? And then what can we do to prevent this from happening?
Yeah, so, when we talk about that, the first time a patient comes in, if I recognize that they have a uveitis, I truly might not do any more digging to it unless there's some other signs and symptoms that make me think, okay, maybe this is a whole body thing that's going on. Because truly, sometimes uveitis, especially when it's that anterior uveitis, it's idiopathic, meaning we don't really know what's actually causing it. So that's one thing, an idiopathic etiology where, we just don't know why it's happening inside the eye. But typically when someone comes back, and like I said, if they have some other kind of interesting presentations, or if I have a feeling that they have a systemic association, we might do a little bit more digging. Some of the tests that we do are tests to rule out things like autoimmune inflammatory disorders, lupus, sarcoidosis, Crohn's disease, ankylosing spondylitis. I have a patient right now that we're working up, and I'm curious to know if they had Behçet's disease. So there is testing and things like that that can be associated. In terms of kind of preventing that specific etiology from occurring, there's been plenty of patients that I've seen that have recurrent or, frequently comes back uveitis. And sometimes that can be a matter of whether or not their rheumatologic condition is under good control. And when it keeps happening over and over again, sometimes we'll ask them, hey, like, are you still being seen by rheumatology? And more often than not, their answer is, no, I haven't seen them in a while. And so we kind of say, all right, we got to get you back in there because we need something else than our own treatment to really control the body's response. Now, other things that can be causing it too are things like an infectious disorder. So it can either be bacterial, viral, or parasitic infections that can cause, again, this body to respond in a way where it's like, I need to fight this. I need to get this infection down. Things like tuberculosis, herpes zoster, toxoplasmosis, syphilis. There are other kinds of these infectious etiologies, but those are the ones that we think of too, again, when we start to look deeply into the eye and see, either laterality being in both eyes, or just different presentations. And then the last thing is trauma. It's really interesting, actually. There, at least one optometrist, can probably recall a case of a patient that had a Nerf gun injury and ended up getting a uveitis from it. That's exactly what happened with one of the patients I saw. So if you can prevent that from happening, definitely wear eyewear whenever you're engaging in sports that are really going to end up having close contact with the eye.
Dr. Seitz, what are the signs and symptoms? I know you probably touched on it a little bit earlier, but what are the signs and symptoms that we need to be on the lookout for to let us know, like, hey, something's wrong, we need to go see our doctor right away?
Yeah, so generally when patients present acutely, they may complain of things like blurred vision, photophobia, redness inside the eye, tearing, or painful or swollen eyelids.
So, Dr. Seitz, thank you for that information. When should someone see a medical professional for this?
Yeah, so I always tell patients, hey, slow changes in your vision, those can be normal. But when you're having something that's new, that's painful, that's irritating, acute changes are never within the normal range. So anytime that they're experiencing any of those symptoms that we talk about, it's a good idea to get checked out because there can be things that we can do to intervene.
Perfect. And just like you said, things that you can do to intervene, what are the treatment options for uveitis?
So typically, because it's related to inflammation, we treat it with a steroid. We can treat it with a steroid in a couple different ways. We can either do a topical steroid, The drop we usually use is called prednisolone acetate or Pred Forte, and it ends up coming in a bottle with a pink top on it. You usually have to shake it up, and then we'll ask you to instill it several times per day. It depends on the severity, and then also kind of depends, how many times per day can depend on the severity, or it can depend kind of on what we're thinking is the underlying etiology for it. But when it comes to the treatment for it, patients that have recurrence with it, they can't stay on it for a really, really long time because steroids themselves have implications within the eye. You can end up getting things like cataracts, or pressure inside the eye can actually go higher. So we never want them to be on it for a super, super long time. That being said, if it's related to, an underlying inflammatory disorder, they may need to get steroid injections in the eye, or even a little implant inside the eye of a steroid, just to have that effect to fight the inflammation that much longer. Additionally, if you're in any pain, your doctor might prescribe a dilating agent called a cycloplegic, and that's primarily just to, one, clear the inflammation from happening, and two, just calm down some of the structures that are involved from spasming and causing you more irritation. In the long run, if things can't be really that well controlled, even from our topical standpoint, your doctor might correlate with rheumatology, and they might initiate either an oral corticosteroid or something like a systemic immunomodulator, something like a Humira or methotrexate.
So Dr. Seitz, let's say, for instance, I have uveitis and I don't do anything with it. I kind of just, go about my day. I live with it. I don't go to see my doctor. So what are the long-term complications or long-term effects of uveitis?
Well, truly, the one thing I never really say this out loud because I don't want to scare patients, but the thing that as eye care providers and also probably patients need to be aware of is uveitis, if it goes untreated for a long time, it can actually cause blindness. And primarily the reason that it ends up causing blindness is because macular edema or swelling at the back of the eye can be really damaging to the center part of the vision. Aside from macular edema, cataracts can form, glaucoma can develop, but those symptoms can actually, or those signs, those long-term side effects can also sometimes develop from the treatment itself. So that's why we said, when in doubt, please seek your eye care provider, because they really want to get this under control as soon as possible and resolve it as quickly as possible, so none of those long-term side effects ever damage your vision.
Well, definitely. You heard it from Dr. Seitz right there. Make sure you go see your medical professional if you notice anything wrong there. Dr. Seitz, what other types of ocular inflammation should our viewers be on the lookout for?
One of the things that's been more interesting and a real hot topic within the eye care community is dry eye disease. It's a different kind of etiology, but there also is inflammation with it. And I think one of the things that has been really exciting, at least in terms of innovation, is we've been really great at detecting it and treating it. Dry eye as an inflammatory condition, there was just so much that we didn't know. But now with the evolution of the Tear Film and Ocular Surface Society, with the creation of DEWS, which is our dry eye assessment workshop study, they ended up finding a lot. So we're understanding inflammation on the front surface of the eye, dry eye, a lot more. And that's something that I think is really great news for a lot of patients that suffer from dry eye. I think one of the other things too, in terms of innovation that is exciting, is just looking into pharmaceuticals and looking into ways that we can deliver drugs more efficiently. So things like different, implants that can be used for glaucoma medications. These all can be ways in which patients can get more long-term relief, because we know that, any kind of treatment too, any topical that we use can actually exacerbate dryness. You have preservatives in drops. It can cause a lot of irritation. So those long-term therapy solutions might be really great for eye care providers and for patients alike.
Dr. Seitz, is there anything that you would like to tell our audience before we leave today?
Yeah, I think, like I say to my patients, if it's something that's acute, that's new, please go see your eye care provider. They're specialists in diagnosing and treating eye disease. Optometrists, we're your primary care providers. So we're here to do exactly that, to get you feeling much better as soon as possible. So never delay treatment. We're ready to help you.
Well, excellent. Again, thank you for that, Dr. Seitz. And everyone, that was Dr. Emilies Seitz from Charlotte, North Carolina. Dr. Seitz, thank you so much for joining us today.
Thanks for having me.